Early signs of a psychopathic child. Psychopathy is often associated with hardened criminals or manipulative adults, but research shows that its roots can sometimes be traced back to early childhood. While it's important not to label children prematurely or unfairly, specific patterns of behavior may signal psychopathic tendencies that warrant closer observation. Recognizing these early signs can help parents, caregivers, and educators intervene with the proper guidance, support, and treatment strategies. What does childhood psychopathy mean? Psychopathy in children is usually referred to as callous, unemotional traits in psychology. These traits describe a consistent pattern of lacking empathy, showing little remorse, and being indifferent to others' feelings. Unlike ordinary misbehavior or defiance, which is common in growing children, these traits are marked by persistence, emotional coldness, and an unusual resistance to discipline or emotional connection. Early warning signs. 1. Lack of empathy. One of the strongest red flags is a consistent inability to recognize or care about the feelings of others. A psychopathic child may show little concern when someone is hurt, dismissing their pain or even finding it amusing. Unlike other children who quickly learn to express sympathy, these children appear emotionally detached. 2. Shallow or manipulative charm. Even at a young age, some children with psychopathic traits learn how to manipulate situations to their advantage. They may appear charming, polite, or affectionate, but these behaviors are often superficial and used strategically to get what they want rather than to form genuine bonds. 3. Persistent lying and deception. While lying is normal in childhood development, a psychopathic child may lie repeatedly, convincingly, and without remorse. Their lies often go beyond avoiding punishment. They may use deception to control others, gain power, or stir conflict. 4. Cruelty to animals or peers. A well-documented early sign of potential psychopathy is deliberate cruelty, especially toward animals or more vulnerable peers. This goes beyond regular rough play. It is intentional, calculated, and often done without guilt. A child who repeatedly engages in such behavior may be expressing deeper callous tendencies. 5. No sense of guilt or remorse. When confronted about harmful actions, most children eventually feel some sense of guilt or show signs of regret. A psychopathic child, however, may deny responsibility, shift blame, or simply act indifferent. They might even repeat the behavior soon after being disciplined, showing that punishment has little emotional impact. Number 6. Reckless or risky behavior. Children with psychopathic traits often demonstrate fearlessness and impulsivity. They may engage in risky behaviors, such as running into traffic, climbing dangerous heights, or provoking others, without regard for consequences. This fearlessness can make them challenging to manage and more likely to engage in harmful activities as they grow older. Number 7. Difficulty forming genuine friendships. Although they may appear socially confident, these children often struggle with maintaining meaningful friendships. Relationships may feel one-sided, with the child using others for personal gain. Over time, peers may distance themselves, leaving the child isolated or constantly cycling through superficial social connections. It's crucial to note that not every child who displays one or two of these behaviors is psychopathic. Many children go through phases of lying, selfishness, or rebelliousness. The difference lies in the persistence, severity, and emotional coldness behind the behavior. That's why evaluation by child psychologists and behavioral specialists is vital before drawing any conclusions. The role of early intervention. The good news is that early detection can lead to effective interventions. Programs focused on teaching empathy, emotional regulation, and consistent discipline have shown positive results. Children with psychopathic traits are not doomed. With proper guidance, structure, and therapeutic support, many can learn healthier ways of relating to others and managing their impulses. Conclusion: spotting early signs of psychopathy in children requires a delicate balance between awareness and caution. Parents should avoid jumping to conclusions, but remain attentive to patterns that seem unusually cold, manipulative, or cruel. By seeking professional guidance early, caregivers can give at-risk children a chance to redirect their emotional and social development toward healthier outcomes.